Hello and welcome. My name is Christine Camizio, and I'm an editor with the health team at US News and World Report. I'm joined by Dr. Leana Wen, who's here to talk with us about her new book, Lifelines, A Doctor's Journey in the Fight for Public Health. Welcome, Dr. Wen, and thank you for being here.
Of course. Thank you for having me. I'm excited to talk about the book and public health.
Of course. Lifelines draws on both Dr. Wen's personal experiences as an immigrant to the United States as a child, as well as her long and rich history serving the public and advocating for public health. Dr. Wen is an emergency medicine physician and former Baltimore City Health Commissioner. And through both roles, she's firsthand seen and worked with patients and community members who are severely impacted by the prolonged shortcomings of public health infrastructure in the US. And Dr. Wen is likely a familiar face for many of you as a contributing columnist for the Washington Post and a CNN medical analyst. And she's been one of the most vocal advocates for public health throughout the COVID-19 pandemic, using her platform to address the federal response efforts and actively combat the spread of mis and disinformation. Dr. Wen, throughout your book, you do a really excellent job connecting both your personal and your professional journey to the greater theme of public health and how it touches every single part of our lives. And so many of us see you in the public eye, and I think part of your lesser known story is that when you were just a child, you came to the United States from China, you didn't speak any English, and neither did your father, and you all were living in a tiny apartment together, having come here with really just $40 in your pocket when you arrived. As you sit here, you would never suspect that by looking at where you are and how far you've come. What got you and your family through some of those initial challenges you faced?
Well, I'm glad you're starting there because it's such an important part of my story, which is, in its sense, a story of public health as well. Actually, when I first started writing Lifelines, I hadn't intended to write about my personal journey at all. I had initially intended to write just about my experience leading Baltimore's health department and the incredible work that my colleagues and our partners and so many people did. I mean, I wanted to share the story, for example, about how our opioid overdose prevention programs saved more than 3,000 lives in 3 years, and how our Be More for Healthy Babies program reduced infant mortality in our city by 38% in a 7-year period. I mean, those are the stories that I wanted to tell. But actually, when I started writing, I also realized that my own story, my immigration story, the hardships that my family encountered, and the sacrifices that my parents made, in a sense, they were also a story of public health. I mean, you shared that my parents and I came with $40 to the US, and we were very grateful to be able to stay because we ended up coming here and being able to stay on political asylum. We were granted political asylum. And yet still, even though my parents were professionals in China, and they worked multiple jobs, we still really struggled to make ends meet. I mean, my mother was studying to be a teacher. She ended up being a second grade teacher in Los Angeles. She also, though, while she was studying, was cleaning hotel rooms and working in a video store. My father was washing dishes in a restaurant. He was an engineer in China, but couldn't find jobs except to deliver newspapers and work in restaurants from time to time. And there were many situations where we could not make rent. We were, at some point, I was begging in front of a grocery store. That was also a story that I had never told in the past. At different points in our lives, we were evicted and were in and out of shelters. And I mean, we were so fortunate. And now looking back and writing the story, we were so fortunate at different points that we were just really lucky. I mean, we were granted political asylum at a time when just a few weeks later, we would have lost our immigration status. We had people who were willing to help us with just a little bit every single time. And thankfully, we did have public health as our safety net, as our lifeline, if you will. And I think what got us through that period, in a sense, was part luck. It was part perseverance, and a lot of it was public health. That's why I wanted to write about it in this book, because my story, too, is a story of public health.
Wow, that's fascinating that you hadn't intended to include it because it is such a big part of the story when you're going through the book. And we'll touch on this more later, but you can see so clearly how you use that experience and draw on it to relate to many of your patients and in particular your community when you serve as the Baltimore City Health Commissioner. I want to talk about in your book when you're going through medical school or you're actually getting ready to go to medical school And you talk about joining the American Medical Student Association. It's a student-led group that advocates for patient-centered care among so many other goals, and how it made such an impact on you. And something you touch on repeatedly in one way or another along your career path is that it takes more than medical school to make a physician, which is AMSA's motto, and how being a doctor is about so much more than technical and scientific skills. It's about advocating and fighting for patients too. And then in your final year of medical school, you recall a story about a patient, Johanita, who died due to life circumstances brought on her, these social determinants of health, and how you couldn't help but look at the situation with empathy and question those circumstances surrounding her. But then you talk about how you go to your attending physician and how they say back to you, it's not your job to open Pandora's box. Don't ask questions you don't want the answer to. Still being a trainee at the time, how did you feel in that moment and how did it shape your trajectory?
Yeah, I'm so glad you mentioned AMSA, the American Medical Student Association, because that was totally instrumental to my getting through medicine. Because I think if it were not for AMSA, I'm not sure that I would have wanted to stay in medical training. I entered medical school with all, I think, the right intentions. I mean, so many students every year do, right? We want to help patients. We may have grown up in challenging circumstances. We want to serve the communities like the ones that we came from. But I also saw in medical school how there were so many things we couldn't do for our patients. I mean, I started medical school in the days way before the Affordable Care Act, when many of the patients that I saw couldn't get help. They couldn't get access to healthcare because they just couldn't pay. I mean, I talked, for example, about a young man I saw who ended up having a seizure that he never recovered from. It was comatose. And his family ended up withdrawing care. But why did he have the seizure? He had a history of epilepsy, but was not able to afford his medications because he couldn't get insured. His health insurance was too expensive. So this young man died because he couldn't get health insurance. I mean, that should not be happening in our society. But I was also taught in medical school, and I went to a great medical school. This is nothing against the medical school. It was rather that I just felt kind of hopeless. I mean, we were taught in medicine, here's what you can do. But what if my patients needed something other than what we were able to provide in medicine per se? That's why AMSA was so instrumental, because I was able to meet other physicians in training who felt as I did, who felt like our job, yes, it was to provide the best care we could for our patients when they came in, but it was also to advocate for our patients, to fight for them, to make sure that if what they needed was healthcare, that we were also advocating on the larger scale for them too. And that's also what brought me to public health, because I realized that so much of what my patients needed wasn't just what we could do in terms of a medication. If my patient had asthma, for example, but they were living in a shelter where everybody around them smoked, or they were living in a building where all the apartments near them were vacant, and that's why there was mold that was triggering their asthma, it's not doing enough if I just give my patient another inhaler. I also have to be helping with the circumstances of their lives, because housing is also healthcare. The food that people have access to, the water that they drink, the air that they breathe, the education they have access to, that's all part of healthcare. And actually, that's what public health addresses.
The story you tell there of your patient reminds me of one that you drew upon from your childhood. So, I mean, you really saw this every step of the way. You talk about one of your neighbors, Tony, who had an asthma attack and wasn't able to go to the emergency room because his grandmother was afraid to take him there. And it's clear that throughout your path, you've seen so many Tonys going through, and so many that are just lacking the basic necessity to get the care that they need. How did you take this and shape it into something? How did you draw on these stories and take a next step and become vocal for patients?
One of my longtime mentors is the late Congressman Elijah Cummings from Baltimore. And I cite him here because Congressman Cummings used to talk about pain, passion, and purpose, that you turn your pain into your passion that becomes your purpose. pain, passion, and purpose. And I think that's very much the story of my career and so many other people's. And part of why I wrote Lifelines was also as a guide for young people, if you will, people who really want to make a difference, aren't exactly sure where to get started. And I want to encourage them to also follow their passion that's often fueled by something really painful in their lives. And I know for me, having watched at an early age, I mean, you talk about Tony, this young boy. I mean, I think I was 10 at the time, and he was maybe a couple years younger than me, was a neighbor that I saw every day. And I mean, I had asthma growing up. I understood what it feels like to be breathless, to breathe in, but not be able to breathe out, and then not knowing whether you'll be able to take your next breath. I mean, I understood that fear and that awful feeling that maybe this could be your last breath. And I saw that Tony really needed help and begged for his grandmother to call for help. But she was too afraid to, because she was afraid that the immigration authorities would come, and not just the health people and the ambulance. She thought that the family would end up getting deported. And as a result, Tony died. I mean, I can remember this and see it as if it were happening right now. And I think that very much had to do with the frustration that I had early on as a child, of knowing that we live in a society that doesn't value everyone equally, and that health is not seen as the fundamental human right that it is. That pain very much fueled my passion, and that is the reason why I do what I do. And I talk in the book too, many other things like that. I mean, my mother was diagnosed with what turned out to be metastatic cancer, but she was first misdiagnosed. And then we also went through some really difficult periods of trying to get her the help that she needed. But I saw the disconnect that was happening in our medical system. And that also became something that fueled my passion and purpose for working in patient advocacy and helping our care to become more patient and family centered. So I think that, again, is a major component of the book, of talking and also encouraging then young people, if you will, and people who want to make a difference, to say, it doesn't really matter what it is that you want to make a difference in. If that's what you really want to do, there are ways to do that. Don't wait for the perfect opportunity. Start now.
Absolutely. So something that piqued my interest there is throughout your book, you really detail your journey, with your mother's care. You talk about it, and later when you're Baltimore City Health Commissioner, that journey of sort of hesitating a little bit and questioning yourself on when and how to speak out in different situations. For example, you recall the first time where you publicly took a stance against Maryland's Governor Larry Hogan in the form of an op-ed when he was withholding funding for an instrumental public health program in Baltimore. And you've really come a long way since then. Particularly during the pandemic, you've been an outspoken advocate for patients and our communities, and your criticism of federal response efforts of COVID-19. How did you find your voice and get where you are today?
Well, there are a couple of things here. One is the recognition that your voice is something that changes throughout your career, and that's okay. As in, I wrote this book in part as a guide for young people. And I think I get asked by a lot of students, for example, about, well, how did you decide on this career path? Or I get asked a lot about work-life balance, which I write about in the book too, because I'm the mom of two young kids. And it certainly, when I was in their shoes, I kind of thought of career and decisions as you have this one chance and you make one choice and that's it. I didn't quite realize that with things like finding your voice and the role that you have to play, it changes over the course of your career depending on what you are doing at that point. So for example, when I was working within city government, it was a very different type of decision to speak out against another person in government, right? That's a very different type of role than when you're the advocate on the outside and you are making change and you're trying to push the insiders on making change. Is a different type of role that you might have. So recognizing the ecosystem of advocates and where you are, the insider making change, you're the outsider. I mean, or you're the person trying to navigate from behind the scenes versus you are the front person. I think there are different ways of making change in that sense. But I think it also took me some time to recognize what one of my mentors, colleagues, Dr. Boris Lushniak, who is the former acting surgeon general, likes to say. He's now the dean at the University of Maryland School of Public Health, but he talks about how you can be political but not partisan. And that's really important to me as my voice, because none of the work that I'm doing is for Democrats or Republicans. I mean, that is not my role at all. I mean, people can run for office, and they should if that's what they want to do. I'm not saying that's not what anyone should do, just that for me, in my voice as a physician, as a public health advocate, that's not my role. However, I also do think that to work and to be effective in public health, you do need to be political because you need to understand politics. You need to understand policies. When you're advocating for or against certain policies that impact your patient's health, by definition, that's being political. But understanding how to navigate those dynamics are also important to public health. And I actually have been writing a lot about this as of late, and I touch upon this in Lifelines too, that public health isn't just about the science, as in you can get all the science right, but if you get the policy and the communications wrong, you have failed. Public health is also about winning hearts and minds. And too often, public health professionals stand back and almost see our work as, well, it's science. And so if you don't get it, that's your problem. Well, I try to make the point in Lifelines that it's our problem, as in, we need to be making the case for whatever it is that people care about. If people don't care about public health, but they care about public safety, we need to make the case that, hey, throwing people in prison because they have the disease of addiction or because they have mental health challenges, that's not helping anyone. Or we make the case that if you care about education, you also should care if our kids are too hungry to learn or if they have unaddressed trauma and mental health issues. I mean, if you care about jobs, then having a productive workforce depends on having a healthy workforce, and caring for families is important for that. And so I think it's really incumbent on us in public health to make the case. And yes, we need good scientists, we need to do good science, but that's not enough for effective public health.
Absolutely. And let's talk about that a little bit. In your book, you take aim at the failure to prioritize public health, COVID response efforts, but not necessarily the failure of modern medicine. And you see that, but the American public might not. So how do public health experts like yourself then communicate with the American people to get them to see that they can put their trust in modern medicine, like, say, getting a COVID-19 vaccine, for example?
It's so hard, and I wish that I had a great answer here. I mean, I think what's been so frustrating during this pandemic, and especially now, is seeing how people actually do, by and large, trust modern medicine. Not everyone. There are definitely some people who are going to be skeptics for whatever reason, who may distrust the system because of historical injustices, who may have some distrust of, quote, big pharma. I mean, whatever, there are definitely some people who are actually skeptical. But by and large, people don't really hesitate to go to their doctor to get their diabetes and hypertension managed. They don't really hesitate if they're having chest pain to go to the ER because they trust that they're going to get good care there. Or if they're in a car accident, they'll go to get care. Or even, and I think this is a bit mind-blowing, if they get COVID, they'll go to the hospital to get care because they trust the care, but they're not going to trust the vaccine that's going to prevent them from getting ill in the first place. And that has everything to do with the pandemic of misinformation and disinformation that we've seen. I think it's challenging. I think it's two parts. I do think that part of this is getting people to see COVID the way that they do other illnesses, to see the vaccine as they do other vaccines, to try to remove the politics and the disinformation from the equation. I think the other part is even harder, which is how do you get people to understand prevention? Because that's ultimately what public health is about. The initial title for the book actually was not Lifelines, it was Public Health Saved Your Life Today. With the understanding that it's public health saved your life today, you just don't know it. Because by definition, public health is what happens when we have prevented something awful from happening. But how do you show people that awful thing that could have happened if not for the work that was done? And I think that is the work that's ahead of us now in public health. We don't want for this child to be lead poisoned and for there to be the face of a kid who was lead poisoned. We want to talk about the home remediation that was so crucial to prevent that lead poisoning from happening. So how do we make that case effectively for public health? I start by doing that in Lifelines, and I hope that many other people will join me in illustrating all the positive stories of public health, because ultimately that is how we're going to put the face on this life-saving and life-changing field.
Absolutely. And I want to dive in a little bit on talking about the pandemic of misinformation and how the response at the federal level really has had catastrophic consequences over the past 1.5 to 2 years. Somewhere in there, experts, yourself included, you note in your book, you begin to have the realization that the response would need to shift to harm reduction rather. Tell us what that means and what that moment of realization was like for you. And also, are we still using that method now?
Hmm. Well, I remember back last April or May, I mean, it was sometime around there when I realized that, wow, here are all these things that we know are going to be effective in stopping the spread of COVID. We know them. I mean, at the very beginning, you could say back in February, March, you could say we really just didn't know. I mean, this was the fog of war, right? There's so much that you don't know. This is a new virus. There were lots of missteps at the beginning, but I think you can understand that and say, hey, we just didn't know. Of course, there were missteps that were going to happen. We didn't even know about masking initially. There weren't enough tests. Look, we understand how that happens in the first place. But then we knew. And in fact, the initial White House COVID team with Deborah Birx and Tony Fauci and others were saying, here's what we can do. There is a reopening plan that they put together that then, unfortunately, the White House itself did not follow, that governors themselves did not follow. And then we got to the point of April or May where it was basically, we know what will work, but we're choosing not to do it. And that was the moment of my recognizing, well, there actually is a concept of public health we can use, which is harm reduction. Understanding you're not going to get to no risk. In this case, it was actually different because harm reduction generally in public health is something that an individual chooses. So, for example, naloxone, Narcan, the opioid antidote, is a harm reduction strategy. You prevent people from dying who would otherwise overdose. You make sure that they have access to naloxone so that they don't die. That's a harm reduction strategy. But this was harm reduction that was imposed on other people, as in our government was basically saying, we could save your life. We're not going to do that. And so I suppose we can now do these things to reduce your risk and reduce your likelihood of dying. I mean, that felt very different. But to your point about, are we still doing that now? Yes. I mean, I think we are at a different point in the pandemic now than where we were certainly a year ago or last May. In a way, it's more frustrating because we have the vaccine that we know will end this pandemic. We're still choosing not to get this in the part of many people. I think, though, that the idea of harm reduction is a useful concept for most people, including people who are vaccinated, because at some point we have to recognize that we are living with risk. We can reduce that risk as much as possible, but we need to now live with this virus, a decision that, by the way, did not have to happen. I believe that if we had done things very differently from the beginning, back last April or May, when we did have the information, we wouldn't be in this position now. But also, if people had been vaccinated even 2 months ago, we wouldn't be in this terrible position that we're in now either.
Well, I just have two final questions for you here as we're wrapping up. As we look ahead, one of the challenges you say we face is the trajectory of public health is long. And you cite Mayor Rawlings Blake, the mayor of Baltimore at the time when you were serving early in your role as health commissioner, that she would remind you that if everything is a priority, then nothing is a priority. And as we look ahead with the number of setbacks we've seen over the past 2 years in terms of trust in leadership, spikes in addiction and overdoses, a growing mental health crisis, where do we go from here? How do we choose our priorities?
It's a terrific question, and I actually worry a lot about this because I think that public health people now see as totally about infection control. And yes, that is very important, and we need to focus on addressing COVID and also preventing the next pandemic, having the infrastructure to do that. But I don't want us to forget the other issues that are also pressing public health priorities. I mean, you mentioned the opioid epidemic. It was an epidemic prior to COVID. It hasn't gone away. Actually, we know that it's gotten worse. Addiction is a disease of isolation. Recovery depends on relationships, and all of that has been disrupted because of COVID. There are many other issues that have been neglected as well. Mental health, the obesity epidemic, HIV, I mean, so many other interrelated issues as well. I think that on the community level is where people need to choose the priorities that are going to matter the most to them. COVID and preventing pandemics has to be one element of this, but I hope that people will choose something else as well. 2 or 3 other things, not a million things, but 2 or 3 other things. And to your point about how the trajectory of public health is long, I also think it's really important for leaders to focus on short-term tangible actions as well. Because otherwise, if you're talking about increasing life expectancy, reducing disparities, things that are very important, but people will forget about them. And it doesn't quite capture the momentum or the attention as short-term tangible actions that then can also galvanize attention and help the community to be motivated to do something else in the name of public health.
One final question for you. With all of the mixed public health messaging throughout the pandemic, moving forward, do you feel Americans still trust the public health field?
I think that many people trust it and understand it a lot more. I mean, consider if you've thought about your local health department or state health department, or understood if there was a city or a county health department where you live. I mean, I think a lot of people understand public health in a way that they did not before. But I also worry that public health has become so politicized, and it itself has been inserted into part of the culture wars where public health officials have been booed and assaulted and scapegoated for trying to do their jobs. I do really worry about some parts of our country where public health, it might actually be even harder for people to do their job moving forward. And actually, my advice to them, especially those in locations where the COVID response is something that's been politicized, is to talk about all the other work that public health does every day that maybe people in that community may not be aware of. For example, the work that even contact tracers often are doing, who are calling people to figure out exposures, but while they're calling individuals are also finding out about food insecurity and are helping them to connect to food resources or housing resources. The work that's done in infant mortality to help with maternal health, to help with bolstering senior centers, to even do restaurant inspections and prevent foodborne illnesses. I mean, all that is also the work of public health. And I think the more that we can talk about all the great work that public health does every single day around the country, the more that we're able to insulate this field and really demonstrate to people the value that public health has in their daily lives.
Dr. Wen, thank you for joining US News for this conversation today on your new book, Lifelines, A Doctor's Journey in the Fight for Public Health, available now. And thank you also for your contribution to public health and drawing attention to this conversation and amplifying it for the American people. It's been a pleasure to speak with you today.
Thank you, Christine. Great to join you.
For more information about US News and World Report, please visit us online at health.usnews.com.